How do you determine which products are best for your skin? Right now, there are probably more brands and products available than ever before. And while this could be a wonderful thing, it could also be confusing with all of these options available. Now, the first step in determining which products are right for you is finding out your skin type. Today's show is all about understanding your skin. This is the Skin Therapy Show. Welcome. My name is Joey Mandangi. Joining me on the show today is Domina Mandangi, who's a skin therapist. She's going to tell us a little bit more about herself as well as the work that she does here. Domina, welcome to the Skin Therapy Show.
Thank you. So my name is Domina Mandangi. I'm a founder of Skin Soul Aesthetic, and by profession I'm an esthetician. So esthetician means skin expert or someone who specializes in skin more and who treats skin conditions. Thank you.
All right, so today we wanted to start things off by talking about why it's so important to understand your skin. Before you get to treatments, before you get to creams, before you get to whatever it is that you're getting to, why is it so important to understand your skin?
It's very important because you really have to know your skin type. And first, you really need to know where is your skin at air. This season, I might be oily skin, but probably I travel for a week or two, my skin will be dehydrated. Yeah. So our skin will change because of change of climate, because of change of probably diet. So we really need to understand our skin first. And if we don't know, then we go to a specialist to help us know our skin type and our skin condition if you have any. So then after that, you'll know then which cream will suit my type of skin now. After probably a while, my skin will change because of my diet or I've gotten pregnant, then your skin will change then. So still, you will have to understand your skin then at that stage.
Yeah.
So it's quite important to know what type of your skin and which cream am I supposed to use, and if you don't know, someone would help you to get to know your skin type, and then they guide you on the skin.
Do you know what I really like about what you just said? You mentioned about the changing of seasons, the changing of issues happening in your life, how that can change your skin. And maybe you thought you were a certain way, and I've always been this way since I was in high school, and then suddenly I'm seeing what's happening with my skin.
Yeah.
So it's important to understand that it changes.
Yeah, it's important to change that our skin will change. Also, depending with climate, depending with age, as we age, our skin will change. Like a teenage, before she gets to teenage, her skin will be very good, or a guy will be a good skin. But as they get to pre-teenage or teenage, their skin will start breaking out, their acne. So they will need to understand where their skin is at that period of time because of age, and they are coming from a baby to a pre-teenage and teenage. So the skin will change at that point of time.
Yeah.
So then again, as we get older, we will get as we get to 45, 35 to 50, our skin then will change to generally to menopause. As we change to menopause, our skin, because menopause affects our hormones. So hormones will change or will affect our skin. So we will have to understand our skin at menopausal stage. Yeah. Again, we will need to understand our skin. If men have beards, you didn't have beards before, and now you start keeping your beards, your skin will change, and you will need to treat it a certain way. So you will need to know now, if I started keeping my beards, how do I take care of my skin? So which skin type am I? So which cleanser should I use? How do I take care of my beards? Which oil should I use? But then, which type of my skin is before I think of a cream?
Yeah. It's a little bit confusing, this whole world of beauty products and skincare products, because there's so many. A lot of people don't know where to begin. Where do I begin? So getting the skin analysis test, maybe you can tell us what that is and how that predicts what products you should be using.
Good. So many people will think in the market we have so many products. When we go to social media, bloggers,
everyone's selling us something.
About skin, yeah, and at some point, someone who doesn't know where to start, they're confused. Where should I go? But first, I would advise you go to a skin expert to know exactly what's your skin type. And then when you go to a skin expert, they will test your skin. They will do a skin analysis, right? They will observe your skin and tell you exactly which type of skin you have. If you have acne, which type of acne, because we have different types of acne.
Wow.
We have different grades of acne. So they will tell you you have grade 1, grade 2, grade 3, and 4 of acne. So they will tell you with this grade 1, this is how you treat your skin and these are the products you're using. At grade 4, or when you're healing from acne, then your skin will change to a different type of skin. When you're healing from acne, you use different products from the one you started using when your skin was active acne. So as skin experts, they will guide you on which products to use and which treatment to be done.
Yeah.
Yes?
And there are a lot of people in the market calling themselves skincare experts. And some of them are not. So how do we select, where to go, who to talk to? What are the proper guidelines for us as we're selecting someone to help us through treatment?
Proper guidelines are everyone is doing skincare, but then how do you choose a proper skin specialist? You will know on their knowledge and their experience. Experience matters a lot when it comes to skincare.
Yeah.
And of course, education. How is this person have taken their education to which level? At estheticians, there is this certification that I would ask people to ask their experts or where they are going to if they have. It's called ITEC. It's an international certification which if everyone has that, they have gone to until international certificate that you can use it anywhere, or they have done international standards.
So they're certified?
They're certified to be a esthetician. So you have to ask that whenever you go to any skin expert.
Yeah.
So that you get to know you're not dealing with quack, but you're dealing with that professional, certified esthetician.
Yeah. Hygiene obviously very important when it comes to this business. In terms of how it is that you uphold that within your brand and your spa business, how is it that you go about that?
Pardon?
How do you go about keeping up the standards of hygiene that are necessary?
Oh, okay. Hygiene, it's very quite important and very crucial when it comes to skin, because when someone comes to a skin or to a skin specialist or a skin clinic, they will expect cleanliness to be number one. And that is a number one thing that we keep up every single day to make sure cleanliness is A1. And for the people who followed us on social media, at the time of COVID, we actually didn't close and our clients were very comfortable. First, we used disposable towels. When COVID came, it taught us how to change things.
Yeah.
We could not share towels. We could not share our bed sheet. So we have disposable beddings, a towel. We have disposable towels, bed sheet. Everything is disposable to make the client feel comfortable. And when we are starting using to do any treatment, we use our gloves. Yeah. We do our masks. And the rooms are sparkling clean. Yeah. And that is what has kept us in the time of COVID, because we've never closed and we ran through.
Good
COVID
for you.
time. Yeah.
Good.
Yeah.
And later on, Domina will share with us her contact information and how it is that you can visit her here at her spa to get that quality consultation and advice as well. We're going to be doing a skin analysis test. A demonstration. Domina will take us through that in just a short while, so keep it here on the Skin Therapy Show. We'll be right back. Welcome back to the Skin Therapy Show. We are still joined by Domina, who's our skin therapist. We're trying to understand our skin more this week. And we're going to now do a demonstration of what it looks like to get a skin analysis test. So Domina, you're on the hot seat. As you see, we've switched positions here. So I'm going to let you do all the technical work.
Okay, so we are going to see, we are going to do a skin analysis. So what we do first, of course, we sanitize. So we are going to check his skin. So the screen that you're seeing here, or the gadget we are seeing here, it's called a dermoscope machine, a skin analysis or a skin analysis machine. So what it does, we are going to it's going to show us the deeper side of our skin where we can't see with the normal eyes. Yeah. So we are going to see under where what is happening inside. If there are blackheads, how big is the blackhead? So let's see. So first thing before I do anything, I'm going to clean his face. So I have some cotton wool here.
Yeah.
It's just water because we don't want to put any product on his skin.
I want to understand the real of what's going on.
So I'm going to wipe maybe if there's any makeup, or probably if they've done a moisturizer.
Yeah.
So we are going to wipe it so that we get a very clean skin.
Okay.
So I'm using just water, cotton wool, damp cotton wool.
Okay.
So that whatever we are going to see, it's clearly skin, no moisturizer,
and this
no
is
nothing.
part of the consultation that you do when you're taking in clients.
Yeah. This is a part of consultation. So what happens when a client comes in, or they call to book an appointment? This is a starting point, because we don't want to do treatment that we don't know what we are treating.
Yeah.
So this is like we are doing analysis of their skin. We test with the dermoscope. We see if they have oily skin, they have a combination skin.
Yeah.
And then
so
when
we know what treatment.
Yeah, we can know which treatment.
Okay.
Yeah.
All right.
So we are going to see. So this is where we normally have good skin.
Right around the neck area.
Yes, like here, we never have much breakouts on our neck. Yeah, the color mostly it's normally our normal color. Yeah. Most of the time people struggle with the color on the face and the neck.
Yeah,
the neck is okay.
Different colors.
Or here at the back of our skin, of our hairs, the color doesn't have any acne, any pigmentation.
Right.
So the color we are seeing, we are going to compare this.
What's happening on the face?
Yes. So let's see. So this you can see how your skin is looking like. So we would say this is your better part of your skin. Like this is good skin. So let's compare the rest of the skin. So when we come here, we can see difference. The previous side of his skin, you didn't have any much of white ends, but like right now you can see we have very big black head. We are also seeing we have a very big white head. We got ingrown, a bit of ingrown. Yes. We also have a skin tag. Yeah.
What is a skin tag?
A skin tag is a growth or it comes with gene. It's a genetic condition that it grows. It's a skin. It's a protruding skin that comes from the face or any part of the skin.
Right.
But now we normally freeze them. There's some people who come to be removed.
Ah.
So during skin analysis, for example, you can clearly see this is a skin tag, but it's not a blackhead or whitehead. So in a consultation card, I will write he has skin tags on his right side or left side. When you start treatment, the acne actually gets worse the first 2 weeks or 3 weeks. So we on consultation we explain what could happen. Possibilities are after treatment, after the first treatment, the condition will get a bit more worse.
You won't like it worse before it gets better.
Correct.
Yeah.
And then we manage this with home care products. But if you see your skin breaking more, if you see dry patches, if you see a bit of reddening immediately after treatment, that is quite normal. If you see a rash on your face after the first 2 or 3 days of treatment, that is quite okay. Yeah. That's why we make the client understand, or we make them understand what could happen immediately after the treatment, ongoing on the treatment, after 4 or 5 days of the treatment. So they are aware.
Yeah.
So if they they see any rash, they will say, Domina said. So we make them sign. Yeah. So they don't come back on us telling us.
Yeah, that's very, very important that you share that information.
But still, that's why we give 2, 3, 4 sessions. Because after it goes worse, you come back after 4 days, 5 days, we calm down the situation. So it gets worse and then it calms down.
Yeah.
Yeah.
Okay, well, thank you very much for this demonstration. It was
Thank
very
you.
informative. So if you're getting your skin analysis test, be prepared. There will be things in there that you might not want to see, but again, facing the truth enables you to be able to get the treatment that you need.
Very true.
Okay, we're going to take a short break. We'll be right back with the Skin Therapy Show.
Thank you.
Welcome back to the Skin Therapy Show, where we're talking more about understanding your skin. Today, we've just seen a demonstration courtesy of our skin therapist, Domina, who's been taking us through it today. Thank you so much for that demonstration. So here's what I want to know. When you do this skin analysis, what do we learn from that?
When we do skin analysis, we are able to see more than what we can see with our normal eyes. Because sometimes we'll assume I have oily skin, I have a combination skin, I have dry skin. But in real sense, we don't exactly know what is happening under. Like we all know, we have three layers of skin. We have dermis, epidermis, and dermis.
Okay.
And at dermis, that is where the real skin happens. And that is where the problem starts. If there is any outbreaks, there is any drainage, it comes from dermis. Okay. So when we are checking with a dermoscope or skin analysis machine, we are trying to check like what is it that it is happening under the skin where we cannot see with our normal eyes.
Yeah.
So the moment we see it, we will know if your skin is more congested, so it tell us you are oily skin. We'll see if you have minimal whitens or blackheads and the skin, we can see dehydration happening down there. Then you're able to know you are dry skin. Right. Like I would not be assuming you are oily, dry, or combination.
Just based on looking at
someone.
someone.
Based on looking at someone.
Yeah.
The gadget is dermoscope. It tries to give us like enlarged problems or from down deep of the skin.
Yeah, that can be a little bit scary for people. Sometimes, we have problems going on with our bodies, with our wellness, with our skin. And we don't really want to know because now we're like, okay, now what?
Yeah. Sometimes it's so scary. Some clients, actually we get our clients when we do the skin analysis, after they see it on their screen, they actually end up crying.
Oh no.
Because someone doesn't expect their skin to be this bad, especially when they have inflamed acne skin or congested skin.
Yeah.
When they see it from inside, someone is so scared and they can't believe it's the type of skin. But that is the bottom line whereby we get the real problem, the core problem. So when we are treating your skin, we are not assuming, we already know and we know how intense is the problem in terms of going to the layers of the skin.
Yeah.
Yeah.
So the information that's gathered from the skin analysis, then you take that information and you do what?
When we take the information, it will guide us on which treatment we are going to give you.
Right.
And which home care products we are going to prescribe for you. And how frequent your treatment should follow. If, for example, of what you've seen on the skin analysis, let's say you have acne skin and the skin is so much congested and our client has acne skin or inflamed acne, we are able to, the skin analysis will guide us to give treatment every single week. After 7 days, they come back.
Right.
Because we need to ease in the inflammation. Yes, we need to decongest the skin. So that's why we'll suggest we give every treatment. So the guideline from the skin analysis will give us we will plan well.
Yeah.
And also we will also make the client understand the cost, because it comes with cost.
I can imagine, especially now if you tell me my skin is inflamed, I need to be here every week. That's something I need to budget for.
Yeah. So still we also know like approximately how many sessions of treatment to be given. And also which the best, according to skin analysis, the best products which are going to prescribe. Yeah, and we're also able to tell you how to use from home, from morning routine, evening routine.
Something else that we can't avoid is aging.
Too.
When you're young, you think you're never going to get old, but the day will come.
When
things are a little bit different. So, is there, when you go to the, shopping for different skin products, and you're seeing everything is anti-aging.
Yes.
Some of them are lying, I'm sure.
Yeah.
But are there just healthier ways to deal with aging and the way that our skin changes?
Aging, we're all getting age, but you can refuse to go there as sooner.
Yeah.
But then how do you refuse to get age? One thing about aging of the skin is the kind of lifestyle you are leading.
Okay.
So one, even if you apply all the creams of anti-aging, but what you're eating, the lifestyle is not correct, then still we are going circles.
Yeah.
Like when we have clients for anti-aging, we tell them it's a lifestyle change. You got to change your diet, and diet takes a great change when it comes to aging. You need to also check your diet properly and also exercise. you need to do exercise. Even exercise for skin, there are exercise, or all exercise when you're exercising, because there's somewhere in consultation where we keep asking our clients, do you do exercise? How is your diet? We also need to know your diet, meaning your diet will count a lot to what the results you are looking at.
Yeah.
So we end up advising our clients, you need to check your diet, you need to do exercise, you need to take lots of water, you need to do supplements. Like inwards, you need to really take care of your skin.
Yeah.
So when we come to do the outer, like when you come to do our creams using yes, we have machines for face farming, anti-aging treatment, laser treatment for anti-aging, but still you will have to check your diet.
Yeah.
You'll have to do exercises.
Yeah.
So to get 100% results, someone has to change a lifestyle.
And they have to take responsibility.
Exactly.
I think in the day and age that we're living in, everyone wants a quick fix.
Yeah.
You know, you're looking for, just give me what is going to fix here.
I know. We always tell our clients on consultation, we have a lengthy conversation. And I always tell our clients that when you come to the clinic, we will give you 70%. You yourself, you have to do 30%. If I do my 70%, you do yours from home, then you're going to get 100%.
Yeah.
And there's no quick fix, especially when it comes to treatment. You have to give the skin the cycle it takes for it to recover.
Yeah.
But there's no way you will get treatment, then in a week or two, you are looking for results to get a smoother face.
Yeah.
We always remind them it's not a miracle. We have to, it has to take its course for the treatment to work.
Yeah.
Yeah.
Thank you so much, Domina. I always learn so much from you. Even just on a personal level, you teach me a lot about my skin.
Thank you.
You know, looking forward to implementing a lot of what you've taught us today.
Thank you, my dear.
Thank you.
Thank you.
Well, what a show we have had today. I'm going to take some final comments from our expert skin therapist for the show today. Domina, final thoughts.
My final thoughts are, I will tell you, like, if you need a skin treatment, kindly go to a specialist or a esthetician, someone who has a knowledge about skin, and get to know, do they know what they're doing? So, yeah, because they will take you through the consultation and they can never make a mistake. Yes, and first is consultation. If you're not done a consultation and someone is taking you to a room for a facial, you're supposed to say no. First do a consultation for both of you to know, what am I suffering? Like we go to hospitals, there's no doctor will take you in for injection before they know what you're suffering from.
Yeah.
The same. So most welcome to our clinic. It's in Westlands, Skin Soul Aesthetics. Come, we see your skin. Let's know what are you suffering. Is it acne? Is it melasma? Is it blackheads, whiteheads? And then we are going to give you a solution and give you treatments. Most welcome to Skin Soul.
Thank you so much, Domina, for all of the knowledge that you've shared with us today and for inviting us into your spa. Remember, we're here to help solve your skincare problems with the advice and the treatments that you need. If you have any more questions or comments, you know the drill by now. Just visit our social media pages on Twitter, Instagram, and Facebook at The Skin Therapy Show. And any questions you have will be addressed in the shows to come. Until next time, I'm Joy Mandangi. Thank you so much for watching.
Thank you.